Speaking on the status of world polio eradication efforts is Dr. Erin Stuckey, Senior Program Officer, Polio, Bill and Melinda Gates Foundation, appearing remotely.
And then also we've got David right up front, David Willy Willman. And what club are you in, David? Nice. Let's give it up for them. All right. He's a local Rotarian in our district, and he's going to speak about the district level polio eradication efforts.
Dr. Marny Eulberg, appearing remotely, is a medical doctor treating polio patients for decades and is a polio survivor themselves. Marny will speak about her personal experience battling polio and treating polio patients.
All right, so how we're going to do this today, it's not a traditional panel, it's more of a triple presentation with a question and answer at the end. So each speaker is going to have about 5 to 7 minutes to present their information to the club, and then we're going to have an opportunity for questions. So without further delay, I'd like to turn this over remotely to Dr. Stuckey. Let's give it up for her.
Okay, thank you so very much. I'm thrilled to be with you all virtually today. And without any further ado, let's get in, because I'm sure we're all eager to hear from the other speakers as well. So let me just briefly share my screen here. Okay, can you all see that? Can I get a thumbs up? All right, wonderful. So as mentioned earlier, I work for the Bill and Melinda Gates Foundation, which is a longstanding partner of the Rotary. And I really just love being with Rotarians, especially on World Polio Day. So this is exciting for me. And as a reminder for the global polio eradication effort, GPEI, there's 6 core partners. You can see them all along the bottom. And this has been an effort in place since the early 80s. And as of today, we have 20 million volunteers, 200 countries involved, over 2.5 billion children vaccinated, all driving towards a polio-free world. And this is a true partnership. So it's not as if there's one organization that's implementing and there's others that are kind of supporting. Really, it's every partner is doing their all and plays a super important role in reaching every last child. So just as a little trip down memory lane, where we were in 1985, 125 countries were polio endemic, all 3 types of viruses. So there's wild polio viruses type 1, 2, and 3, and more than 40 children were getting paralyzed every hour. And as you know, Rotary was kind of the head of the charge globally and really getting the polio eradication effort going. And this was such a severe situation. And I'm going to move forward. And today I am thrilled to share that there's only 2 countries left that are endemic, 1 type, and it's only Pakistan and Afghanistan that have had any cases this year. There's only been 2 cases this entire year so far. The last 2 cases were in January in both countries. Now that's of the wild type. So this is incredibly historic, and I can't impress enough on you all how important this is. The world has never seen such little polio ever before. And we had last year, we celebrated the whole Africa region being polio free. You can see the screenshot there. That was from the celebration, and that's the Nigeria EOC, Emergency Operations Center. And I don't know about you, but I can just feel the excitement and joy just through that photo. And it's kind of wonderful that even with COVID, we can all kind of experience these things together. But now we need to really move forward and, as the introductory speaker said, deliver on this promise of having a polio-free world. The global community has spent the past year creating a strategy in order to do that. It was launched earlier this year, and this is and I'll spend the next couple slides just talking through what exactly is going on in order to really finish the job and what that's going to take. And again, you can just see that we're really at the end here. So the wild polio is only type 1 left. And as you know, there's circulating vaccine-derived variants in Africa, but The great news is that there's a new vaccine that has been rolling out all through this past year in order to address those cases. But that's really considered an outbreak scenario. This what we're talking about here is wild polio virus, and there's only 2 left, which is amazing. So how do we actually go about finishing this job? No matter what country you're in, no matter where you're going, there's 3 main elements to program. Step number 1, finding the virus. So we investigate each and every child that is paralyzed. And that's because there's multiple things that cause paralysis in children. It's not only polio. So you have to do an investigation. Samples are sent to the laboratories to test for the virus. We also do active surveillance by taking samples from sewage, and because you can detect virus that's around in the environment. This is important because it acts as an early warning system. So it saves months in the whole time it takes, because there can be virus in the environment months before it ever shows up in a child. So we can detect it early. We can do a campaign with vaccines in order to prevent any child from being paralyzed. So not only is there have there been no cases, right now in Pakistan, all of the environmental surveillance sites have all been negative for the past 2 months. So it's really encouraging. Step number 2, okay, once we know where the virus is or is not, it's finding the children. So there's detailed planning and monitoring that goes into every single polio campaign. You can see a screenshot of the map that was used in one of the maps used in Nigeria to make sure that every single house, every single village, every single hamlet is on a map and can be reached, so that all of the infrastructure rolling out all of the campaigns is making sure to reach every child. And then there's monitors that go on and make sure that the campaigns are happening with good quality, that every household is in those micro plans, that all of the environmental surveillance sites are being visited, that the physicians know what they're doing on what day for the campaigns. And then number 3, obviously vaccinate. The main tool preventing polio is making sure that every child is reached with vaccine. And we do this through multiple ways. So routine vaccination, you go in for infants, they receive all sorts of vaccines. I won't list them all. I'm sure those of you with kids remember taking your kid to the doctor to get vaccines. So it's the same everywhere in the world. Unfortunately, there's a lot of places where the routine systems are not reaching everyone, and the systems are not robust enough. So that's when we have to have these supplemental house-to-house campaigns. And those are the SIAs, where I'm sure you've seen lots of pictures of polio workers. You can see some on this slide with their blue vaccine carriers, many of which are donated by Rotary. So thank you for that. And you can see the top picture there. I took that photo in September of this year in Karachi in Pakistan, which is the main place that I work, supporting the efforts in Sindh, Pakistan. And there's flooding, there's rains. The efforts of these frontline workers, mainly women, are simply heroic. I mean, this is the heart and really the backbone of the program, is people that are really involved in their communities. They know families, they know where the kids are, and they really spend a lot of effort and go to extreme lengths to make sure they're reaching every child. And we can't do this program without them, and we want to make sure that they're supported in any way that they can be. And finally, communications and community engagement for acceptance. As you know, there's a lot of anti-vaccine sentiment, and for not just polio, COVID, this has come up, measles even in the US. So there's a lot of work that the international community does to ensuring that these efforts are funded, to make sure that all of the communities are involved. They know when campaigns are happening. All of their concerns are addressed. There's a lot of reasons why people are hesitant about being vaccinated, and we need to be able to understand what those reasons are, so that they can be adequately addressed. And then finally is communications and advocacy. So making sure that all of the efforts are appropriately funded, that there's buy-in from the governments, that there's enough support for the program. So these are steps 1 through 3. This is how we eradicate. And the new strategy has identified specific areas that are important to now, at the point we are, with so few cases, finish the job. And Rotary is a big part of that and continues to be part of that. So as you know, every single dollar that Rotary clubs around the world is matched 2-to-1 by the Gates Foundation. The Gates Foundation and the Gates family in particular has always been very, very strong partners with Rotary. One of my bosses, Bill Gates, has been a keynote speaker at the Rotary conventions. And of course, Bill Sr. was a longtime Rotarian. Rotary also helps do things like establish hand washing stations in very high risk areas and water filtration plants, making sure that teams have places to stay. And then when they're going out for campaigns, and then also on border crossings between Pakistan and Afghanistan. There's a lot of movement of people back and forth. People have families on both sides, etc. So there's making sure that at those border crossings, any child that goes through receives a vaccine. So and then of course, the advocacy side. So the photo on the right is with Aziz Memon, who is the committee chairman for the Pakistan National Polio Plus Committee, and also is a trustee of Rotary Foundation. And so we work with Rotary not just internationally, but in also not just a global way at the global level, but also in every single country that we work in. So just to close, thank you for your individual contributions. I mean, every single dollar that is donated goes towards the life-saving vaccines, supporting the frontline workers, all of the logistics and supply chain and all of that goes into a campaign. And we can't be more grateful and really thrilled for the contributions of Rotarians, including yourselves. So thank you so much, and I'll pass it on to the next speaker and look forward to chatting more later.
All right, Willie, I think you're up next. Yeah.
Well, good afternoon, everybody. Thanks for having me. Thanks to Bill and Fred putting everything together. And as Dr. Stuckey had said, here in District 5450, we've had some giants that have done a lot of this work on the ground, such as Carl and Grant Wilkins and others that have spent numerous hours, numerous days and weeks and months doing national immunization days over these periods. I think one of the things that our district will start looking at as we hope to get to that finish line in 2025 is getting back to those NIDs, National Immunization Days, as well as we can travel again safely. And as we know, everything is still just a plane ride away, so we have to be safe with ourselves so that we can be safe with others. One of the things that you'll hear coming up with Dr. Eulberg, who is the chair of our District Polio Plus Committee that I'm a member of as well, is, our focus has really been on fundraising, but in the past year, but we're ready to educate again because of the fact it's not just about polio, it's about the viral strains that we see, including the current pandemic that's happening in many issues. And it really affects what we're doing to get to that finish point. It really does. And so today, you're going to hear a nice story and a nice piece from Dr. Eulberg. And what I would just impart is, as Dr. Stuckey said, every dollar really matters. $25 is 2 of the current COVID polio vaccination kits, just these full kits that they have to go around. And so it's just a couple of Starbucks away, you can make that happen. And one of the other things that we've really started up in our district is a sustained commitment of $100 annually. You can join the Polio Plus Society. It's something we've started to see worldwide. And so we only have a few dozen members in our district so far. And if you're already making that contribution, join the Polio Plus Society so we know we have that sustained commitment all the way through. I think it's, we give you little tchotchkes and our little pins, and we love that. And I just impart how special it is to be a part of this work for all of us as Rotarians. And to see Dr. Stuckey's picture with Trustee Memon. I put an article from him in the last month's district newsletter. So just make sure you took a look at that. I think he says some really pertinent things. And one of the things that he really talks about is it doesn't end even in 2025. It's got to keep going in terms of our vaccinations, because being polio as a preventable vaccinated issue, we can eliminate that, but there's going to be others. And as we've seen with the measles and some of the smallpox things around the world that have risen back up, it's just so important. And it's important for our kids to understand these things as they move forward. And this country has such a heavy focus in science and STEM again, which I think is wonderful. It's just important to have those conversations, even with your grandkids, about what some children have had to go through. And one of the great slides that I thought Dr. Stuckey really shared was in the steps 1, 2, or 3. Really, if you narrow it all down, that's Rotary's 7 areas of focus. We can connect all the dots here and continue to do our WASH projects, continue to do education, disease prevention, maternal health and literacy as we move forward. And so think about those things as you're moving forward in your work, that piece is a bigger part of not only the vaccination workers and what we can do sustainable, but eliminating a lot of these issues worldwide. And then finally, before I turn over to Dr. Eulberg, just one of the things I would think about, I saw some questions on chat while I was watching Dr. Stuckey, was just talking about the Taliban and Afghanistan, and I think we all had a little bit of a take back. It's just kind of an interesting policy and foreign policy view and how we've done things, but I can tell you, and the news that just had come out this week, that starting November again, they are going to allow women to be those frontline workers again for vaccination in the country of Afghanistan. I think that's huge, and Dr. Stuckey pointed that out, that the culture there is women have to have those conversations with other women. That is a key piece, and especially with the children feeling more comfortable around women in more traditional gender roles in their culture. It's just such important news to come out this week, and so we should be very encouraged how that's going to move forward. So once again, I just impart the District 5450, we're working very hard. I was with District Governor Ray this morning at my club meeting for his annual visit. I know he sends his regards, and we're looking forward to eradication, quite honestly. We just all need to take a breath, and we're going to get there. And I know us in the Polio Plus Committee, we're very passionate about this, and we've got room for you. Come join us. We meet the second Wednesdays of every month, and we just had our Rotary Day at the Rocky. If any of you had attended that Rockies baseball game, we're going to do another one in the spring. So we're excited about that. No, it's not opening day. We don't get those prime seats. But we're real excited about this partnership with the Rockies. They're very amenable to helping Rotary and help spread the word. So I'm really excited about that. And finally, I'll give you a save the date, January 29th. You're probably going to see an email on this in about a week. But that is going to be our annual kind of RI Presidents, in this case, dinner. It's going to be on a Saturday night, January 29th. We'll probably have President Shekhar virtually with some other special guests. We're working on the special guests. And we'll have a Polio Plus update during that time, but it'll be nice to have Shekhar, which he'll be actually breakfast, but we'll be in dinner mode. And we're going to try to do a hybrid event, something small and in person, but also definitely on the Zoom piece as well. So be looking out for that information. We'll be sharing that shortly. And thank you so much. And Past President Darrell, you want me to introduce Dr. Eulberg again? Get her going? Okay, we'll just get her going. So Dr. Marny Eulberg, what is impressive about our Polio Plus District Chair is she just quietly goes about her business. And she just has such a unique story in the way she deals with Polio Plus survivors. And I hadn't seen her work live as our District Foundation Chair until earlier this spring, where I went up to Easter Seals Camp and saw her a little bit in her work, and just how people were engaged with her, and they just respect how they all have shared something unique in life that they've all had to deal with and overcome. So Dr. Eulberg, take it away.
Thank you, Dave. Let me share my screen. Okay, so Sorry, I'm having a challenge here. Well, we can do that this way. So I joined Rotary because of their dedication to eradicating polio. Probably not a great surprise since I am a polio survivor. I don't normally talk much about my polio, but I was asked to do that today, so we'll go forward. My polio journey began in October of 1950 when I was 4 years old, and that was 5 years before the vaccine was available. Both my sister and I contracted polio, and the picture on the left is me in the Hubbard tank, which was a way of providing warm, pulsating water to help with the soreness in the muscles. And on the right, I'm the child in the tricycle. I was hospitalized for 6 months. My sister was hospitalized for 6 weeks. But to put that in a little context, back in 1950, if a woman had a normal vaginal delivery, she was in the hospital for like 7 days. And if people had a hernia repair, they were in the hospital for 4 or 5 days. So these days, probably I would have only been hospitalized for maybe 2 or 3 weeks. This is a picture of my sister and I about 10 years after polio. The arrows show the leather calf cup on the braces. It affected my left leg and my sister's right leg, which is sort of interesting because when I was in medical school, my mother made me a pantsuit outfit, and we always had made the legs narrower on the side of our polio affected legs, and she made the wrong leg narrower. As you can see from the picture I showed before, and I can tell you, braces weren't designed to look good, and particularly for a young girl. They were usually attached to one ugly pair of brown or black orthopedic shoes. Kermit said it's not easy being green, and likewise, it's not easy being a child with a disability. You know, in grade school, junior high, high school, you're teased even if, you know, called four eyes because you wear glasses. So any little thing that deviates from the normal can be a reason for others to tease you. These days, it probably would be called bullying. You're frequently the last to be chosen for teams because you're not the fastest. And adults always felt like surgery should be done like during summers and school vacations, which as a child, I never understood. It may have made the surgery a little more palatable if it had happened and let me miss some school. Thanks to excellent medical care, after 4 orthopedic surgeries, I was able to get rid of the leg brace, but I've always walked with a limp, and my left leg was and still is much smaller and weaker than the right, and you can see that in this picture. Some of you may or may not have heard of post-polio syndrome. Statistically, up to half of polio survivors will develop post-polio syndrome sometime in their lifetime. It's not a new infection. Nobody has gotten polio from someone with PPS. And there's lots of theories about the cause, but it's really not been totally identified. The symptoms can include some combination of increasing muscle weakness, which then can result in decreasing function, pain in the muscles and joints, and at times unexplained fatigue. It also can cause worsening breathing problems in people who had difficulty breathing with their initial polio, or increasing problems swallowing in people who had swallowing difficulties with their original polio. For me personally, in 1985, I needed to go back into a leg brace. And it's over this time, every 10 to 15 years, I've needed to move one step up in terms of the bracing and assistive devices. But, you know, I was lucky in that I was here in the United States where I had access to good medical care. I attended public schools and was mainstream, had all the educational opportunities of any person without a disability. But the countries we're talking about in the developing world, the people who get polio don't have access to the kind of medical care or the educational opportunities I had. So they're going to have much more difficulty being productive and having even the quality of life that I've had. I will say that adversity taught me to be perseverant and determined. And it used to be true. I'm modifying it a little now, but if you told me I couldn't do something, I would make sure that I proved to you that I could. If it's been interesting as I've seen polio survivors since 1985 in a polio clinic, actually have not seen very many people from Boulder. And I'm sure they've got to be out there. There also is not, we haven't been able to identify enough people in Boulder to have a support group that meets in Boulder, but we do have support groups across the Front Range, 3 in the Denver metro area, 1 in Colorado Springs, 1 in Pueblo, and 1 in Fort Collins. For those of you who know people who are polio survivors, some of the resources include Post Polio Health International, and I put their 2 websites here. One's post-polio.org and the other's polioplace.org. Colorado also has a very active post-polio organization. Dave mentioned that he attended our post-polio camp in August, and that's the 4th time we've done a camp. We'll be doing it about every 2 years. There's a quarterly newsletter. There are support groups around the state. There's I go out with a team periodically to parts of Colorado other than the metro area and do a traveling clinic. And to the Yggdrasil's website is not real user-friendly. You need to find the polio stuff, you need to click on our programs and then on post polio. Colorado's Post Polio Clinic I established in 1985. I've seen over 1,500 people since then, and it's now held at my handicap accessible home on an as-needed basis. Currently, well, before the pandemic, I was seeing about 40 or 50 people a year. And that's all I have to say for now. We can open it to questions. And I understand they're in the chat.
Thank you, Dr. Eulberg. Thank you very much. And as you said, we are going to open it up to questions now. So Cassidy, if you'll organize those on Zoom, and then Vanessa, if you want to see if there's anybody in the audience who has questions, and then Willie, we'll let you come back over here.
Peter Ewing on Zoom had a question. I think Cassidy was going over to Peter Ewing.
Well, I was wondering, and actually, the question was answered with the notification from the Taliban that they were open to vaccination and allowing the women to do the vaccination, do the communication. But a problem has always been killing of the vaccinators, and with Al Qaeda and ISIS and so on. I hope that the Taliban will be able to deal with that issue and allow women to continue vaccinating and not be threatened with death.
Yes, indeed. I can help jump in here a little bit, just to add to some of the words that Willie mentioned earlier. So there have been campaigns ongoing in Afghanistan, but there has not been one that has reached everywhere. So there's about 3 million children in Afghanistan that have not had access to a campaign since 2018. So that's a long time.
Yeah.
And so now that it's fabulous news that there's now this notification of a campaign and that the women are able to access children. And just to note that this is something that's coordinated at the same dates as the Pakistan campaign. So on both sides of the border at the same time, they'll be able to get everyone. The good thing is with what we're seeing at the moment with in Afghanistan is that there's essentially since the Taliban are able to are the government and able to support the campaigns, they're also providing security for the healthcare workers, and it's an excellent point. There has been such challenges with security in both Pakistan and Afghanistan in the past. So it's in Peshawar, for example, in one of the main cities in Pakistan, there's a security escort for every single polio team that goes out door to door. So it is something that is a really unfortunate part of the work, and the countries are extremely committed to be able to provide that kind of security and support. So thanks for the question, Peter.
Okay. I understand that vaccine-derived polio was a big problem and that the new vaccine has been formulated to somehow take care of that. Can you provide more details on how it was done?
Sure, happy to. And thanks for that question. It's something that definitely comes up often. It's so the vaccine, so the new vaccine has been in the works for years, and it is specifically for type 2. So the main vaccine derived variant is from type 2, and basically this one is much more genetically stable, so we don't have this issue as much of it reverting back into a type that can be transmitted. And so this was done with partnership with the Gates Foundation as well as the pharma companies to be able to do this vaccine. I think that the challenge now is making sure that there's enough global supply. So there's not those constraints. And an important part, it's a fun fact that everyone knows about emergency use listing, EUL, from the COVID vaccine, but actually the polio, it's called NOPV2, really catchy name, but NOPV2, this vaccine was the first vaccine to ever be approved under the emergency use listing for WHO at the end of 2019. So actually this vaccine approval process helped pave the way for the COVID vaccines to be approved under that listing. So thanks again for that question.
Dr. Eulberg, my father had polio in the 50s and then post-polio syndrome in the 80s and 90s. At that time, there seemed to be very little that could be done to treat it, no medications that I was aware of for it. What advances have been made? What treatments and medications are available today for people with PPS?
All right, well, there's still no medication. A number have been tried and none have been found to be significantly beneficial. It is, and so there's not a cure. Once somebody develops post-polio syndrome, we can't stop that. It is a slowly progressive condition, but there have been great advances made in bracing and some of the mobility devices. Also in terms of respiratory equipment for people who have breathing issues related to polio. And I grew up on a farm in South Dakota. I tell people it's sort of like keeping the old combine or the old pickup truck going another season or two with bubble gum baling wire and duct tape. But sometimes that worked reasonably well. So there's the good news is that post-polio syndrome won't kill you unless you have respiratory issues or swallowing issues that you don't address or choose not to address. but it certainly can affect people's quality of life and their lifestyle.
Thank you.
This one's also for Dr. Eulberg. I'm just wondering, does the vaccine have any therapeutic value if caught early? In other words, if the vaccine had been available 5 weeks after you contracted it as opposed to 5 years, could the any part of the disease been mitigated?
Probably not.
Oh,
I mean, the way it
thank
works,
you.
the way it works is inducing immunity, and pretty much by the time somebody's diagnosed, because they have to have some paralysis to have people think about the diagnosis, the damage is already happening.
Thank you.
If there's a difference between the people, the number of people that are refusing to be vaccinated that have issues with, with respect to polio versus the pandemic, is there a way of assessing the extent to which that differential is attributable to political resistance?
Not that I'm aware of. What is interesting to me as I'm seeing polio survivors, and when we did our post-polio camp, is like 95% of the polio survivors have all been vaccinated against COVID, and most now are getting their 3rd dose.
I'm not really sure who this question should be directed to, but what does victory look like here? I mean, if we're 2 cases away from 0 cases this year, does that mean it's eradicated if next year has 0 cases? And is there work to be done to maintain a 0 case level from there?
Should I take that one?
Sure, you can take that.
Okay, so that's a great question. So the WHO has guidelines for certifying diseases as eradicated, and the WHO guidelines are: a country can be certified as eliminated if there's no cases seen for 3 years in a row, and they can provide all the evidence that there's none that they're missing, so that the surveillance systems are robust enough to be able to track it. So the photo I showed of the Afro region, certified polio-free. So you can certify the countries as having eliminated, you can certify the regions as having eliminated, and then the next step is obviously global level. So let's say that the last cases, that those in January were the 2 last cases of wild polio virus in the world. What will then happen is the clock started ticking for those 3 years once those cases came up. So for the next 3 years, we'll be even intensifying campaigns more, intensifying surveillance. So there's work to be done over the next 3 years. Then there will be a committee that comes in to verify all of the paperwork that needs to be verified and do all of the investigations that are needed. And then after that is mopping up the last bit of the vaccine-derived variants. And of course, then making sure there'll be a phase out for then the world will kind of phase back vaccination. So like smallpox, for example, we don't vaccinate for smallpox in the US anymore because that's the disease that's been globally eradicated. So that's the kind of steps. So there's lots of work still to be done, and we're so close, and it's even more reason to not just sit back and say, okay, we're almost done. It's almost done. Let's actually kind of really make sure. I mean, this is an incredible opportunity. I mean, to get to this point again would be a lot of effort. So it is even more important to make sure that we're finishing the job.
Great. We have one last question.
Thank you for your presentation. The cases that just happened in January, what type of treatment do those patients get once they are infected?
So sorry, go ahead. Does someone else want to take that one?
Oh, go ahead.
Yep.
Okay, so the cases, so it's estimated that there's somewhere between 7 and 10 million polio survivors that are around the world today. I don't know, Dr. Eulberg, that's the figure that I knew. Is that about right?
Yeah, that's good.
Yeah, so there is within Pakistan and Afghanistan, the WHO has a program where they work with families on rehabilitation. So luckily there's so few cases now that they're able to, every single case that comes up, they're able to bring into the program. And so they'll receive kind of rehabilitation, braces, other sorts of supportive programs. I'm not a medical doctor, I'm an epidemiologist, so I can't give you the details of all of exactly what they receive, but they're absolutely followed up. It's not a matter of, okay, there's a case and then walk away. And so it's called, I think, the Polio Survivors Fund, and it's something, if you're interested in contributing to that, I'm sure you can find out more info on the WHO website.
And I'd like to just add that, part of the reason vaccination is so important is there really is no effective treatment. It's not like you get a strep throat and you get penicillin and your strep throat's gone. Even today, we don't have an antiviral against polio. And so once somebody has polio, the treatment's going to be pretty similar to what it was in the 50s.
Dr. Stuckey, Eulberg, and Willy, thank you so much for such a wonderful presentation and to bring us up to date on how things are going with the worldwide eradication. I'm a physician as well, and it's kind of near and dear to my heart to think about people getting vaccinated. And I remember being 4 and standing in this line in a gymnasium with my mom to get my oral polio, and she just looked so happy. And I had that same feeling when I got my COVID vaccine last January. So I hope people understand how important it is to worldwide health to be vaccinated. And this is kind of preaching to the choir. You guys know how supportive Rotary is about eradicating polio. And it is always our joy to donate 100 vaccines in honor of the speakers who come and present to us at Rotary. So again, I want to thank you for that, and you will have the 100 doses from our Rotary Club. Thank you.